All right, well, we're going to go ahead and get started. Like to welcome everyone. I'm Dominic Shvaya. I'm board chair of the Qlarant Foundation, and I'd like to thank you for taking your time to join us today. We hope that you'll find today's program both interesting and inspiring. We are joined by several Qlarant Foundation board members and members of the Qlarant leadership team. And on their behalf, I'd like to congratulate you all on being awarded funding during our 2021 grant cycle. We actually reviewed 79 applications this year, and you're here because your grant applications rose to the top of the foundation list because we felt that your programs would have the greatest impact in the communities in which you serve. We really feel like we have a strong lineup of organizations this year, some old ones and some new ones, and we're really excited about it. Our Grantee Award celebration has evolved over the years from a short meet and greet and a photo op, and it's something that we would hope is a little bit more valuable to the organizations we fund. Our desire was to get all of you passionate, creative, and hardworking people in a room and talk about what you do and how you do it, in the hopes that this would lead to some networking and some sharing of ideas that would be worth your time. Having had to go virtual both last year and this year has hampered this effort somewhat, but we hope that with the videos that we'll be watching, our brief question and answer period, and our keynote speaker, that our vision can be achieved on some level. However, before we get to all that, we are going to get a welcome greeting from Qlarant CEO Ron Forsyth, who unfortunately could not be here today, but he has recorded a message for us to listen to.
Good morning. I'm Ron Forsyth, CEO for Qlarant. Sorry I cannot be here in person for the virtual meeting. It turns out I actually have an in-person meeting in DC today while everyone else is virtual. So I seem to be opposite of everyone else and out of sync. But I'm really glad to bring greetings before today's meeting. It's really exciting. I'm sure Dominic has already spoken about the amount of money that we've given over time. But I really have to emphasize that the number of awards this year, I believe it's 79 applications and 18 awardees and 2 gifts. I mean, congratulations to each of you for the effort that you put forward. When you look at the things that we do here at Qlarant, overall, we summarize the work we do in kind of 3 big buckets. First of all, we help the good guys. Second of all, we fight the bad guys. And the third and the most fun part of that is we give away money. And we're really excited that you're all here to be beneficiaries of the money that we're giving away this year. The foundation was officially formed in 2003. We started, putting some of our reserves and excess money into the foundation in about 2006. I'm really pleased to say that at this point we hold about a $17 million fund overall within the organization, and we're really pleased that we're able to give out money to support the community. Again, congratulations, and thank you for participating in our event.
All right, and now I'd like to introduce the Qlarant Director of Marketing, Pat Bowes, who's going to tell us more about who Qlarant is and what we do.
Good morning, everyone. I'm so glad you're here. Congratulations. I will say the competition was fierce, and you should be very proud that you've made it this far and are part of the Grantee program. We're very proud of you, and welcome to our event today. I am going to trust that most of you have been on our website and know a little bit about Qlarant, but few people know all about Qlarant. So I'm going to give you a brief overview of who we are and what we do so that you are more comfortable with the company that you're working with. Most people don't know that we are in 3 major areas of business. The first being our quality improvement program. It's very important that the healthcare and medicine industry have people that can follow up and support different organizations independently and be able to rate companies and make sure that they're doing the quality reviews that are so necessary to keep us all healthy. And the second area of business that we're in is in fraud, waste, and abuse. And it's amazing how many bad guys are out there abusing the Medicare and Medicaid system, and how many billions of dollars this represents. So with our help, these industries can go out and identify the people who are doing this and bring them to justice. It's a very interesting and fascinating business, actually. And the third area is our technology sector. And this is really important because, as you know, technology changes really fast and it changes quickly, and it's important to keep up with it. And we use technology to help those first two divisions, as well as to branch out into other industries. And then, of course, you know probably the most about our foundation, and we'll speak more about that later. But it's important to know the company that you're working with. In addition to our divisions, I'd like for you to understand that we are not just a Maryland-based company. Although our headquarters are in Easton, we are a national company, and we're nationally recognized for the work that we do. So we're in all 50 states, and we have offices throughout the country. Now, recently with COVID, what's been very helpful to us is before COVID, we had lots of people who worked from home, and after COVID, we all worked from home. And fortunately, because we had the right systems in place, it worked out really, really well. We did not have to lay off any people. We did not lose any business because of COVID, because our teams were already at the ready and had those processes in place. So we're very fortunate to be able to say that. In addition, and something that we're very proud of and what the company was founded on, are our missions and values. We are very sincere about our ability to provide great work. We have great experience. We have high ethics, and we're proud of the work that we do. We demand it across all areas of business, from top down and from bottom up, and it's a culture that we're proud of. We've actually won culture awards for being the best place to work, both locally and nationally, and we have awards and reviews for the systems and processes we have in place. So something that I'm personally proud of, and I know that all of our associates are. And then finally, I think what is also interesting are the number of employees and associates we have both locally and nationally, and the types of associates we have, from Six Sigmas to PMPs to PhDs. Across the nation, we have analysts and clinicians, investigators, ex-FBI folks. We work with a lot of subcontractors, and we have over 40 major contracts. And proud to say, we are fast approaching our 50th year. So we're very proud. We're proud of us, and we're proud of you for being a part of this group. And I welcome you to Qlarant. And as Ron said, who are we? We fight the bad guys with our fraud, waste, and abuse initiatives. We help the good guys with our quality review, and we help spend the money that we make with those in need, and that's the foundation. So welcome, and again, congratulations. Back to you, Dominic. I think you're on mute, Dominic.
Here we go. All right. Well, thanks, Ron and Pat. We want to recognize again that the foundation funding is only possible due to the exceptional leadership and employees of Qlarant, and for that we're certainly most grateful. All right, we're going to go ahead and get into our introductory videos and question and answer period. However, before proceeding, I'd like to take a few moments to give a recognition to and a big thank you to Dave Morell, Andrew Bowers, and Glenda Moreniel for their time, their talents, and care in editing and creating these videos, which we're going to watch, these posters, which you'll receive, these booklets, and some online content, which we'll be using today, but also hope you'll be able to use for your own fundraising and publicity in the future. They've really done a tremendous job, as they always do. So what we've done here is we've divided the grantees into groups of 5, which are actually listed in the agenda if you have that available. And after the video for each group, we're going to give each organization the opportunity to respond to a question which was provided in advance regarding an aspect of their organization. So we're going to go ahead and get started with the video with group 1.
Hello, my name is Chris Sherrard, and I am Director of Philanthropy at Helping Up Mission, located in historic Jonestown in Baltimore City. Our mission is to provide hope to people experiencing homelessness, poverty, or addiction by meeting their physical, psychological, social, and spiritual needs. We serve nearly 540 men and women daily, and nearly 2,500 men and women and children over the course of a year, with programs ranging from meeting basic needs such as food, shelter, and clothing to the largest long-term residential recovery program in the Mid-Atlantic region. We are grateful for Qlarant Foundation funding that will provide access to health care and dental care for men and women who are in long-term recovery programs here at Helping Up Mission. Your funds will pay for direct dental care with our dental services partner, University of Maryland School of Dentistry, and also for salaries for home staff providing access to health insurance.
Hello, my name is Preeti Neputheri, and I'm the Deputy Director at the International Rescue Committee in Silver Spring, Maryland. Each year, thousands of individuals forced to flee violence and persecution are welcomed by the people of the United States into the safety and freedom of America. The International Rescue Committee in Silver Spring works to provide opportunities to humanitarian immigrants, including refugees, asylees, victims of human trafficking, survivors of torture, and other immigrants to thrive in America. The IRC, since opening its door in 2006, has worked with over 10,000 humanitarian immigrants from over 30 countries. Funding from the Qlarant Foundation will help the IRC's Bridge to Healthcare initiative provide trauma-informed, client-centered services to victims of trafficking so that they can access culturally and linguistically appropriate healthcare services in Montgomery County and Prince George's County in Maryland.
Hello, my name is Julie Lowe, and I'm the Executive Director of Talbot Interfaith Shelter in Easton, Maryland. The Talbot Interfaith Shelter is dedicated to ending homelessness on Maryland's mid-shore by providing shelter, stability, support, and a path to success for families and individuals in need. These are the tenets of our S4 program, which is a long-term program designed to address the root causes of poverty and homelessness and to guide our guests to lasting self-sufficiency. Qlarant is providing funding for TIS to purchase at-home COVID tests so we can monitor the health of our guests. The funds will also help us purchase drug testing kits so we can maintain a drug-free environment for those in our care.
Hello, I'm Susan DuPont, a co-chair of Talbot County Empty Bowls with Anna Harding. Talbot County Empty Bowls is an independent, all-volunteer grassroots organization with a twin mission to raise funds to eliminate, if at all possible, hunger insecurity in our county, one bowl at a time. The second one is to raise awareness of this serious and fundamental issue in our county. Qlarant Foundation's grant to us, for which we are deeply grateful, particularly in these times, will in its entirety join the other funds we have already raised, and we hope to continue to do so, and be gathered to become a distribution for the pantries we serve early next year.
Hi, I'm Bill Shreves, President of the Bay 100 Community Volunteers. We are honored to be a recipient of a Qlarant Foundation grant for our modular wheelchair ramp program. The Bay 100 Community Volunteers have been providing home repairs for residents of Talbot County for over 20 years. Anything from a grab bar in a bathroom to replacing a set of steps, installing a storm door, fixing a leaky roof. In most cases, the work is done by our volunteers and the only cost is for materials. Our goal is to help residents with a financial need remain safe in their homes and thrive in their communities. The modular wheelchair ramp program is an exciting new component of what we do.
Okay, so the question that this group was asked to answer was, in what ways does your organization work to build community with other groups, businesses, or other nonprofits? So when I call you or your organization, if you could just please unmute yourself and take about 1 minute to respond to this question. And we're going to start with Helping Up Mission. I believe it's Jennifer Bedden who's joining us today.
Hi, thanks. Yes, that's right, Jennifer Bedon. Thanks so much for having me. I am so glad that I have been chosen to answer this particular question because at Helping Up Mission, we work with partners to achieve our impact. So we manage here at Helping Up Mission 8,000 appointments every month. And those appointments are primarily for services delivered by partners in the community. So those are, healthcare appointments, substance abuse counseling, dental, legal, education and workforce development. We have a GBMC clinic right inside of our facility. We have 5 Johns Hopkins psychiatrists and counselors who work for the hospital, but the place they report to work every day is Helping Up Mission. Our strong network of community partners was never more important than during the pandemic, where we had access to testing and vaccines and advice on how to remain open. But none of this is as important as partners like Qlarant, who help support the most vulnerable in our community. And we are so grateful that you have chosen Helping Up Mission to be one of your partners. Thank you.
Yeah, thank you. All right, and next I believe we have Ruben Kandrasekar with International Rescue Committee, which is one of our new grantees.
Good morning, everybody, and just want to say thank you sincerely to the Qlarant Foundation for funding us this year for the first time. Working with refugees and people seeking asylum, individuals who are fleeing from a labor or sex trafficking situation often requires us to provide them with housing and a home for the first time in a long time. And while we are funded by federal and other private sources to set up apartments for our clients, those furnishings can be quite modest, kind of what's needed. And thanks to one of our partnerships with an organization called Homes Not Borders, this is a group of individuals in the community who want to provide a welcoming environment for newcomers, particularly humanitarian immigrants. And over the last 12 months, they've helped us to set up and furnish 29 apartments for our clients, which impacted 160 lives. And they donated over $45,000 in in-kind furnishings to further help, our clients feel at home when they step into their apartments for the first time, often in over a decade after displacement. So that's just one of the ways that we work closely with community partners to make Montgomery and Prince George's County in Maryland a welcoming environment for our clients. So thank you.
Thank you. We're excited to have you on board. All right, and next we have, I believe Julie Lowe is going to be joining us. This is Talbot Interfaith Shelter, also a new grantee.
Hello and thank you. We are very grateful for the grant from Qlarant, and it will help us continue to build community liaisons. We feel like we're very good at this in Talbot County. We work with a lot of other nonprofits and social service agencies to help our guests achieve success. Our program is called S4, and we start with shelter and support, and we help people become stabilized. And then we move into the success, where we help people move into transitional housing. And we partner with the Housing Commission to provide apartments and private landlords. We have a business partnership program where businesses in the community can contribute funds or in-kind donations, and we publicize them at all of our events and all our communications. We have over 400 volunteers who help us keep things going at the shelter, and they reach out to their circles and share what we do so that we engage more and more people in the community. We work with other groups such as food missions and churches to do the work that we do to help people become successful. So thank you, Qlarant, for all you do for our community.
Yeah. And thank you. Okay, and then another Talbot County organization, Talbot County Empty Bowls, Anna Harding. Or if there is anyone else available from Talbot County Empty Bowls. All right, it doesn't seem like anyone could make it. They're actually a gift that we've made for the last 2 years, and you heard about what they do in the video. So we are happy to be funding them as well. And I believe I saw our good friend Bill Shreves earlier with Bay 100 Community Volunteers. Bill, you're up.
Good morning. We are blessed and honored to again be a recipient of a Qlarant Foundation grant for our modular wheelchair ramp program. In addition to that program, we also provide general repairs for residents of Talbot County. The most frequent need we see is for bathroom renovation and roof repairs, and these kind of projects often exceed our financial resources. We partner with several different organizations to complete those projects, including the Maryland Rural Development Corporation, Chop Tank Electric Trust, Habitat for Humanity Chop Tank, and the Easton Affordable Housing Renovation Program. For example, we're currently working on a bathroom renovation for a Tillman Island resident, and we're partnering with the Maryland Rural Development Corporation and Chop Tank Electric Trust to get the funds we need to do that. Prior to the pandemic, the Bay 100 Community Volunteers hosted a meeting of all organizations, both governmental and nonprofit, providing home repairs in Talbot County. This opened up lines of communications between the organizations. Since then, we often pass projects to each other based on the nature of the project and available resources. We plan to hold another meeting in the fall, and I'm looking forward to being able to come up with a universal assistance request form. Thank you again, Qlarant, for your support.
All right, great. Thanks, Bill. Thanks for everything you do in our community. All right, we're going to go ahead and move on to our second group of videos and a different question that they'll be answering.
Hi, I'm Tammy Seltzer. I'm director of the DC Jail and Prison Advocacy Project at University Legal Services in Washington, D.C.
The mission of University Legal Services Jail and Prison Advocacy Project is to work with returning citizens, both men and females, returning back to the community with multiple levels of barriers, not being able to communicate, advocate for themselves, not being able to have the proper income or the proper housing that they need. So our job is to help them reach those goals.
Well, Qlarant funding will be used by ULS to support our multidisciplinary teams of social workers, advocates, lawyers, and peer navigator to support people with psychiatric disabilities who are coming out of jail and prison.
Hi, I'm Susan Harwood, the newly appointed Executive Director of Critical Repairs Caroline County, formerly known as Rebuilding Together Caroline County. We are a nonprofit organization dedicated to providing assistance to low-income homeowners who are elderly, disabled, veterans, or families with children facing necessary but unaffordable repairs or upgrades to their homes. The generous grant we have received from Qlarant will enable us to assist 3 to 5 low, very low, or extremely low income households to have a safe and healthy environment in which to live. The financial support covers the cost of materials and hiring MHIC, independent contractors, to make medically necessary critical repairs or improvements that enable our disabled clients to stay in their homes and age in place.
Hi, my name's Sue Bell, and I'm the Director of Foundation Relations at Miriam's Kitchen. I just wanted to say thank you so much for helping us with our mission, which is to end chronic homelessness in Washington, D.C. Your funding's helping us provide services to people who are living on the street. These people don't have access to toilets. They don't have access to washing their hands, even when the CDC says that you need to be hand washing. Every day we're providing meals to about 300 people, and thanks to your support, we can also connect people with medical care, mental health support, housing, and income support. Right now in Washington, D.C., there's about 1,600 people who are chronically homeless, which means they've been homeless for more than a year. And thanks to your support, we're providing all kinds of services to them. Personal protective equipment like masks and hand sanitizer. Also, we're enabling them to have access to bathrooms 11 hours a day. And we have trained social workers that are providing them with all sorts of services in addition to meals. Thank you so much.
Hi, I'm Kate Fahrenholt. I'm the Executive Director of NAMI Maryland. NAMI Maryland and our 11 local affiliates across the state represent a statewide network of more than 53,000 families, individuals, and community-based organizations and service providers. Although anyone can develop a mental health problem, people in rural areas, including and often especially minorities, experience a lot of unmet needs and other barriers to accessing mental health care. We are so thankful for this grant, which will support an initiative to bring highly effective education and support programming to individuals affected by mental illness and their family members who live in rural areas of Carroll County and Southern Maryland. The initiative involves the signature NAMI programs of NAMI Family to Family Education, NAMI Family Support Groups, and the NAMI Peer-to-Peer Relapse Prevention and Recovery course.
Hi, I'm Mary Kay Diabaldo. I'm the Executive Director at There Goes My Hero. We are located in Timonium, Maryland. The mission of There Goes My Hero is to save lives, provide hope, help those impacted by blood cancer. There Goes My Hero serves all people who are in need of a bone marrow transplant or other services in Maryland, DC, Virginia, Pennsylvania, and Delaware. One of our main initiatives at There Goes My Hero is to make sure people are registered on the National Bone Marrow Registry. We hope to build bridges with communities of color so that we can diversify and color the registry and save lives and provide hope.
All right, so with group two was tasked with answering the question and sharing their answers to what strategies does your organization use to recruit and retain volunteers? And we're going to start with Jane Brown at University Legal Services.
Good morning, everyone. I'm Jane Brown. I'm the Executive Director of University Legal Services. Can you hear me?
Can hear you, yep.
Okay, great. So happy to be here this morning, and we're most grateful for continued funding from the Qlarant Foundation. And I must say I'm quite choked up by hearing about all of the great work that each of the grantees is doing. It's so outstanding and very emotional to hear what a great job everyone is doing and meeting great needs in the community. ULS provides reentry services for men who have mental illness and who have been incarcerated and who are returning to DC from the Federal Bureau of Prisons. So our work promotes access to community-based healthcare and mental health care to promote successful reentry for our clients. At the DC Jail Prison and Advocacy Project at University Legal Services, we focus on developing an educational and worthwhile volunteer experience tailored to the unique interests of the volunteer. Wow, we are successful when we find volunteers that often recruit themselves. For example, we had several Wellesley interns every semester during the pandemic, and they were so thrilled with the program that they encouraged other Wellesley students to volunteer. So during the pandemic, we made sure that they could contribute in a meaningful way, even though their work was virtual. Meeting clients is critically important to motivate and inspire volunteers. Some interns interviewed clients so we could include their stories in newsletters. Others helped clients write testimony to educate DC council members about how the traumatic experiences they had experienced as children and youth led to their involvement in crime. Our recommendation is find volunteers with a passion for the cause, trust and support them to do meaningful work and you will have a volunteer program that sells itself. Thank you.
Sounds great. Good advice. All right, and now Susan Harwood with Critical Repairs, Caroline County.
Hi, everybody. We used to be known as Rebuilding Together. We're a small organization with deeply committed members. Recruiting is typically done by board members personally inviting folks to participate, often through church contacts. We also have participation by high schoolers doing their community service requirements. Some of our board members are themselves volunteers in the field or at the salvage depot we operated for many years. Our volunteers have typically participated for many years. They get to see firsthand the impact of their efforts on the lives of individuals and families in our community where the need is so great. It's personally gratifying and builds camaraderie among our group. Efforts to retain volunteers include appreciation events, birthday cards, and acknowledgement of their efforts in communications. But in actuality, it's the work itself that keeps our volunteers involved. Thank you.
Thank you. All right, I know Sue Bell's here with Miriam's Kitchen.
Hi, everyone. We are very lucky at Miriam's Kitchen to have about 1,500 volunteers every year. And this last year has been particularly strange for us and for everyone else. And we had to ask our volunteers to stay home. So a lot of our volunteers are older people, as in my age and older, and it was just not safe for them to be at Miriam's Kitchen. So we had to implement a pretty strong communications plan to keep people engaged, but ask them to stay home. So we had a very small core group of about 10 volunteers. This is only about 20% of our usual team in every single day during the pandemic, every weekday to prepare and serve meals. So we've been very grateful this year that our volunteers have been patient with Miriam's Kitchen, and they will come back when it's safe for them to do so.
Thank you, Sue. All right, and we have National Alliance of Mental Illness, Karen Fahrenholt.
Hi, good morning. I'm Alexis Brown, representing NAMI Maryland. NAMI Maryland has a variety of peer-led education and support programs for all who are affected by mental illness. These programs give individuals living with mental illness and their families a place to turn to access a strong network of education and support. Here at NAMI Maryland, we provide the trainings for family members and individuals living well with mental illness to become effective NAMI support group facilitators, education course teachers, and NAMI advocacy and outreach speakers. After being trained by NAMI Maryland, these individuals deliver NAMI programs in their local communities at the affiliate level or directly through NAMI Maryland. We utilize the train-the-trainer model, which is recruiting individuals with lived experience to pass on their knowledge and expertise to individuals and family members who truly need it. At NAMI Maryland, we support local affiliates and volunteers in delivering signature programs across the state. We assist our affiliate with program planning, recruitment, community outreach, and problem solving when needed. We're really grateful to be the first-time recipients and to partner with your foundation. Thank you so much.
Thank you. Yeah, we're happy to have NAMI on board as a new grantee this year. And to finish off this group, we're going to hear from Mary DiBaldo from There Goes My Hero, also a new grantee this year.
And thank you so much to the foundation for the wonderful gift. Please know that we will be good stewards of your money. It is greatly appreciated. One of our basic strategies to recruit and retain volunteers is we have an AmeriCorps/Volunteer Maryland service member whose only role is to recruit and retain volunteers. We have been lucky enough to be chosen for the third year. And while that may seem unsettling, the great thing about it is we get a fresh new perspective each and every year. We send out satisfaction surveys. We have special newsletters just for our volunteers to let them know what's going on in the office and what our upcoming events are that they can volunteer for. We have virtual as well as in-person training. And the most important thing that we found during the pandemic was to change what we thought of as a volunteer, because donors, bone marrow donors, are our most valued volunteer, as is our board members. So if you change the definition of a volunteer, your strategy will change. And most importantly, we always say thank you.
Good. And thank you. We know how much how important these volunteers are to your organizations and how much you value their work. So. All right, well, moving along, we're going to go to our third group with the videos followed by a different question.
Hi, I'm Megan Morgan. I'm the Executive Director of Girls in the Game. At Girls in the Game, our mission is to empower girls to grow into strong, confident leaders using sports. We're not a competitive sports organization. Rather, we use sports as a vehicle to teach girls confidence and teamwork and all of those important lessons that naturally go along with sports. We strive to serve girls over the long term, so our hope is that girls get involved at a young age, like 7 or 8, and they stay involved throughout high school. At Girls in the Game, we know that not all playing fields are created equal. For this reason, we mostly work with girls of color from underserved communities. While we think that all girls could benefit from Girls in the Game, we want to reach girls who don't have other opportunities for sports and leadership development. Funding from the Qlarant Foundation will be used to fund both our after-school programs for elementary and middle school girls, as well as our programs for high school girls. Our goal is to give girls opportunities to try a bunch of different sports and learn the fun of being, active and healthy, and at the same time, discovering their own strength, learning how to work with their teammates, and to discover their confidence and strength.
Hi, my name is Kimberly Weiner. I'm the Senior Director of Development at the Ullman Foundation. The mission of the Ullman Foundation is to change lives by creating a community of support for young adults and their loved ones impacted by cancer. The Ullman Foundation serves adolescent and young adults impacted by cancer and recognizes that young adults affected by cancer are not benefiting from progress in cancer prevention, screening, diagnosis, and treatment to the same extent as other age groups. At the Ullman Foundation, we share the Qlarant Foundation's goal of improving the health of individuals and communities. For us, that happens through the programs we create, within the resources we construct, and with the experts we engage to support adolescents and young adults impacted by cancer. Funds from the Qlarant Foundation will be used to support our residential program for young cancer patients at Ullman House. The purpose of this program is to reduce the financial burden that young adult and adolescent cancer patients experience during cancer treatment.
Hello, my name is Sue Ann Shapley, and I have the privilege of serving as Executive Director for a therapeutic summer camp called Camp Attaway, based in Columbia, Maryland. The mission of Camp Attaway is to ensure that all children, even those with complex social and emotional challenges, have the ability to have a summer filled with fun, friendship, and personal growth. Additionally, we support the mental health of their parents by providing bi-weekly parent education and support groups that are facilitated by a child psychologist. Funds from the Qlarant grant will be used to fund a myriad of very important areas at Camp Attaway.
On behalf of the University of Maryland Children's Hospital Breath Reveal program, I extend a huge thank you to the Qlarant Foundation for helping to support our mission to keep our asthmatics healthy, especially at this time during the pandemic when our families are facing even more challenges than ever.
The mission of the Breathmobile is to address the pediatric asthma epidemic in Baltimore City by increasing access to specialty-based preventive asthma care to children in underserved areas. Through the care provided on the Breathmobile, our goal is to see children in school and learning and out of the hospital. We also want to see our patients lead healthy, active lives with the ability to play sports and sleep well at night without asthma symptoms.
The Breathmobile program has a big impact on the families and the communities that it serves. The knowledge and the tools that families receive on the Breathmobile empower them to care for their child with asthma. Children who receive care on the Breathmobile see a 60 to 70% decrease in emergency room visits, hospitalizations, and missed school days due to asthma. This translates to healthier children who are in school learning and parents who are able to be more productive and don't have to miss work to care for a sick child.
Hello, my name is Nicole Hauser. I am the Executive Director of the Community Free Clinic in Hagerstown, Maryland. Our mission is to make health care accessible to all uninsured residents of Washington County, Maryland. Our clinic sees, again, and this has been for over 30 years, we have seen the uninsured of Washington County, Maryland. So that includes residents who are working full-time but cannot afford to pay for the health assurance that is offered to them. So this funding will help in the sense of continuing our programs and helping those who need it the most.
Okay, so for group 3, your question was, what strategies do you use for fundraising? And I believe we have Deidre O'Rourke with Girls in the Game.
Hi, thank you. Good morning, everyone. And thank you again, Qlarant, for your continued support of Girls in the Game. So our primary strategy is to build authentic relationships. That's with individual donors, with funders like Qlarant, with corporate partners. And we do that by really fostering connection with our mission and with the girls that we work with. So we see a lot of especially women who played sports when they were younger and saw all the benefits that they got from that experience. We also have some proud girl dads from Qlarant who were happy to come out and participate alongside girls in our programs. So we try to provide a lot of engagement opportunities for supporters so they can really experience that direct connection. So if you're playing little Sally Walker alongside girls, or you're sitting on a career or college panel, it gives that real connection. And just as we strive to keep girls engaged as they age, we want to do the same with our supporters. So, we've been fortunate to have a lot of long-time funders, and we're happy to say Qlarant's among those. So thank you again.
Yeah, thanks, Deidre. I did have the pleasure, along with Lamont Thompson, another foundation member of before the pandemic, of coming out and visiting, and really an amazing program. So thank you.
Thank you.
And do we have anyone with the Almond Foundation with us today?
Yes. Hi, Dominic. Hi, everybody. My name is Kimberly Weiner. I'm the Senior Director of Development at the Almond Foundation, and we are so appreciative of the Qlarant Foundation's support of Almond with the work that we're doing to ensure that young adults have access to services while they go through cancer treatment. We have a lot of strategies that we use for our fundraising efforts. Like I said, are looking to advance our mission to ensure young adults are impacted by cancer have psychosocial resources, free lodging, and access to services to not go through cancer alone is really kind of our goal here. And really at the cornerstone of our work is relationship building. We look at relationship building as a crucial part of the work that we're doing, to not only with our patients, but with our donors as well. And we look to do good stewardship activities. We really tailor a lot of our activities to our higher level donors to kind of go to where they're at, but looking at opportunities too to work with lower level donors as well. We're looking at new strategies now with planned giving efforts. We try to do A/B testing with annual fund emails and direct mail appeals. And we really try to prioritize the donor and what they're interested in, how we can get their gift to have the biggest impact on our mission. And this goes in line with knowing our donors and that relationship building part of our work. Thank you.
Great. Thank you, Kim. All right. And Sue Ann Shafley with Camp Attaway.
Hi, I just wanted to express my gratitude for being here today and the generosity of Qlarant. My answer is very specific. I'm giving maybe some tips about how we approach fundraising. First and foremost, you have to make it fun. You want people who don't have a personal connection to your nonprofit to want to attend the event. The reality is there are so many fundraisers out there that yours has to stand out. Our goal at the camp is to keep it fun, and we really try to bring that idea to fundraisers. We also try to focus on creating a branded event. If you are like us and have a small staff, you really don't have development staff, you really can't concentrate on large numbers of events, but focus on maybe a couple of events per year and make sure you have a catchy title, an event logo, the look that keeps people sort of aware of the event. You have to focus on getting corporate support. And I do that by being active in the community and leveraging my board to reach out to their connections. Thank you.
Sounds great. Thank you. All right, and next we have the University of Maryland Medical System Foundation. This is their Breathmobile program. And I believe we have Tina Miller who's joining us.
Yes, hi, good morning. I'm Tina Miller, and I am with can you hear me?
We can hear you, yep.
I am with the University of Maryland Medical System Foundation, and we are very grateful to Qlarant for support of our important Breathmobile program. The Foundation fundraises for the University of Maryland Medical Center's 2 campuses located in West Baltimore, where we serve people who are low income, underserved, underinsured in our hospital. And a lot of our community a lot of our community-based programs rely on philanthropic support. So again, we're grateful to Qlarant for supporting the Breathmobile. Our strategy includes engaging individual donors, grant funders, and we have several fundraising events throughout the year. We do have a major gift officer who focuses specifically on the Children's Hospital, which is where the Breathmobile resides. And our development team meets regularly with each other and with program staff to understand priorities of program needs. We communicate regularly with our board members, with local business leaders, with foundation program officers, so that we can continue to fundraise from all areas of the community. For grants specifically, I rely on a lot of resources like Foundation Directory Online. I use various e-newsletters that I get on a regular basis to learn about grant funding opportunities. And I also rely on our program staff for suggestions of places they've heard about. So we continue to seek potential funders for the Breathmobile that are interested in pediatric health and asthma care.
All right. Thank you, Tina. All right, and finally, with this group, we have another new grantee, Community Free Clinic, and Nicole Hauser.
Hello, Nicole Hauser. And first, I'd just like to say thank you for funding us this year. Our biggest strategies are, of course, grants that we are constantly researching and reaching out to new grant funders. And then events, and our largest event, which we haven't been able to hold, but in normal years, it is a crowdfunding event. So not only do we have the fundraise from It's a Mud Volleyball, not only do we have the fundraise from the teams, but we encourage those playing to also reach out to their friends to get sponsorship for the event that they're playing. We have business who sponsors the events. We have individuals then who are also donating funds. And then a lot of our patients, believe it or not, always are donating because they realize the value that they're getting from our service. Even though they can't afford that insurance, they want to be able to give back to us. We do a lot of informational newsletters and just networking.
Okay, thank you. There's a lot of really great information there, how different organizations, different sizes, and use different strategies. So it's very, very helpful. All. Thank you very much. All right, and we have our fourth group of videos and questions we'll go ahead and get started with.
Hello, I am Dr. Marla Dean, and I am the Executive Director of Bright Beginnings. I want to thank you for your support of our mission and our work. And I want to tell you a little bit about our mission. BBI uses a two-generation approach to ensure that every child experiencing housing instability or homelessness is healthy, safe, engaged, supported, and challenged. We also want to make sure that each of them are school ready and kindergarten prepared.
Hey, I'm Alex Miller and I'm an art therapist. At Bright Beginnings, I work as the Child and Family Trauma Support Therapist. Our program serves children prenatal through age 5 and their parents and caregivers who are facing housing insecurity and family homelessness.
Hello, I'm Toyika Milam. I'm the Program Director here at Bright Beginnings. Your contribution will be used to assist the children and families we serve with getting supports they need related to mental and physical health.
Hello everybody, my name is Joyce Ofer. I'm the Executive Director here at Eastern Shore Wellness, the place to be on the Dorchester County, Eastern Shore. We are truly so grateful to the Qlarant Foundation and the board members for choosing us once more for being redeemable in the community to do their services that they have as close to their heart, and that is to be able to facilitate what we need to do in our community for the people who deserve it the most. We want to thank you again for choosing us.
Hi, my name is Ashira Dotson. I'm President and CEO of Eastern Shore Wellness Solutions here in Cambridge, Dorchester County, Maryland. The organizational mission for Eastern Shore Wellness is to build a framework within our community to help individuals advocate for their own health concerns. Our goal is to make sure that we are providing health education and training to our community members, and we do that at no cost. The funding from our Qlarant grant that we were awarded will be used for outreach in our community.
Hi, I'm Dr. Regina Hampton. I'm the Medical Director and co-founder of Breast Care for Washington in Washington, D.C. I founded Breast Care for Washington on the belief that healthcare is a basic fundamental right, and critical to this is equality of access to healthcare. Our mission is to reduce breast cancer mortality by promoting access to breast cancer screening, diagnostics, and treatment for all women, regardless of their ability to pay or insurance status. Breast Care for Washington is the only facility in the Washington, D.C. area currently providing breast imaging services to the uninsured. Thank you to the generous support we receive from the Qlarant Foundation that allows us to provide care to these women.
Hi, my name is Jackie Fala, and I'm the nurse manager for the Grace Center for Maternal and Women's Health, which is located in Berlin, Maryland. The mission of the Grace Center is to provide a safe place to improve the maternal health of the women in our community. The Qlarant Foundation will continue to fund Project Hope. Project Hope helps a vulnerable population that we serve to access services that are paramount to the health of a pregnant woman as well as that of her newborn. We serve Wycomico, Worcester, Somerset, and even Lower Sussex County in Delaware. Qlarant has graciously helped fund this boutique that I'm surrounded by. Thanks, Qlarant, for trusting us again.
Hi, I'm LaWanda Bornstein, President and CEO of the House DC.
The House DC is breaking cycles of poverty, homelessness, incarceration, and unemployment by providing at-risk youth in Anacostia with comprehensive services to help them establish healthy and sustainable futures. Our mission is to connect youth and their families to Christ through creative programs that meet both physical and spiritual needs. Funding will be used to continue our food program that consists of our chef who teaches youth to prepare healthy meals, which we give out to the community. We also will be purchasing needed equipment and providing groceries as well. Although the House DC is located in Ward 8 in Anacostia, Southeast Washington, D.C., we also provide support to families and youth in the entire Washington, D.C. community, as well as Prince George's County.
All right, wow, those were all just some really great videos that we've been able to watch there. So for our final group, been asked to answer the question on how do you decide whether to stay small or grow big as an organization? And we're going to start with Bright Beginnings. If someone is here to represent Bright Beginnings.
Hi, everyone. My name is Taylor, and I'm Bright Beginnings Development Manager. Thank you, Qlarant, for awarding us. We're a new grantee, and we're happy to be here. Thank you for your support. So ideally, you know, growing big would mean that we would extend in our services, or we could honestly work ourselves out of business. So that way there won't be homelessness existing in the Washington, D.C. area. But on a little bit more quantifiable level, we do a needs assessment with all of our families every 45 days. And so that's how we keep up to date on what we need to do as far as customizing our services through a two-generational approach for children and families who are experiencing homelessness.
Great, thank you. All right, and Ashira Dotson with Eastern Shore Wellness Solutions.
I'm sorry about that. Good morning, everyone. Eastern Shore Wellness, of course, thanks Qlarant for their continued support with the grant funding. But one of the things that we want to do in order to make the decision to grow big or stay small is stay connected to our community. And so for us, staying small affords us that opportunity. We know that we want to engage and impact our community members, but in order for us to do that, they have to believe in the programs and services that we provide. And so we choose to remain small at this time, although we're growing, because we want to build that framework for trust in the community. But we also want to have a foundation for strong relationships built on that trust. And so, of course, you know, our goal is to stay, again, connected to the community that we serve through the use of our community health workers, through that relationship building, and through that trust building. So, you know, our team of community health workers, you know, work diligently in our communities. And so the people that we serve, they trust us. And so we love that about the organization and being able to connect with the community that we serve.
Thanks, Ashira. You may be deciding to stay small, but the amount of work that you do is anything but that. Really amazing what you do in your community. All right, and then we have Angela Warner with Breast Care from Washington, D.C. All right, it seems like Angela wasn't able to make it this morning. So we'll move on to Grace Center for Maternal and Women's Health.
Hi, I'm Jasmine Dennis. I'm the Executive Director at the Grace Center. For right now, this is actually a great question for us because we are facing a situation of deciding on growing. While we are small, we know that we do need to kind of extend a little bit further. However, we want to make sure that we can still carry out our mission on a larger scale while still harboring that small, loving, homey environment that makes us so unique within our community. We know that it's time to grow a little bit because we can no longer find some of the solutions that our clients need without growing and being able to fully utilize our network outside of our walls to further our mission is really important to us. And we're getting to that point where we are able to kind of use that network a little bit more through all the collaboration that we've been doing to kind of get us out there a little bit more and grow.
Thank you, Jasmine. All right, and then we're going to conclude with our also a new grantee. This is House DC, and I think LaWanda Bornstein is here with us today.
Thank you, Qlarant, for the grant. We're so grateful. So how we decide whether we're going to stay small or grow big, it's very organic. And, you know, we start off as a small youth center just in Southeast DC, but over time we realized that we need to connect to the larger community. So we started to grow. And then over time, we realized, you know what, we needed to start reaching out to organizations that were interested in hearing what we did. And so when I look at growth, I look at it more organic. It's not something that we decide that we're going to do or we're not going to do. We just try to meet the needs of the community, the surrounding area. But I do think that we grow in other areas where we may not physically be there. You know, we had an organization reach out to us in Ghana. And so we went to Ghana to help them establish a youth program. We had another organization that reached out to us in Zambia. So we went to Zambia to do training for parenting. We had an organization that came and toured our facility, and they were from Japan. And so they wanted to understand, how do you work with, you know, with people in poverty, and how do you do that? So I look at organizations like the House that really does have a much larger outreach, but it may not necessarily be every single day that they're doing that. And so, you know, we just look at things, trying to meet the needs and just make it organically happen. Thank you.
Great. Sounds like some very interesting international programs there that you have. So thank you for that. All right, and really, we thank you for your engagement in this exercise. Certainly feel like there's a lot of helpful information there to digest, and also hope that you're able to get to know some other organizations that are providing services in your region. You know, for me and for us, it's always insightful to hear the ways in which you continue to evolve and improve services for your clients. So I hope that was helpful to you. It was certainly very nice to hear from all of you and to understand how you continue to provide services to your clients. So now it's actually my pleasure to introduce again Sue Bell to the group. She's going to be our keynote speaker for the day. Sue, as she mentioned earlier, is the Director of Foundation Relations and grant writer for Miriam's Kitchen in Washington, D.C. She's been there for 10 years. The Qlarant Foundation has supported their drop-in program for social services since 2018. And Miriam's Kitchen, they really exemplified the tireless creative effort that many organizations gave over the last year and a half as they managed to remain open throughout the pandemic and never stopped providing services to the homeless community of Washington, D.C. And it's really quite a heroic feat. And I believe Sue is going to talk a little bit about how they achieved this. I've always felt energized after talking to Sue, and I'm sure you're going to feel the same way. So without further ado, Sue, take it away.
Thank you. Thank you so much. I'm really delighted to be part of this program today. This is the back of Miriam's Kitchen. We are a short walk from the White House, and you'll see the toilets that we have here. What we focused on was our COVID response effort. As many of you do, we focus on homeless services in Washington, ending chronic homelessness. And as part of that, we provide meals and healthcare and mental health support, as well as housing support. And you can see here, we have the tents and the toilets out in the back of the church where we've operated for about 30 years. And then our focus was, like many of you, the world went virtual. So how do we continue to help our clients? And that was a really big challenge for us because we have support services for people in housing, and our social workers could not go visit people in housing. So we had to purchase phones for some of our residents in permanent supportive housing so they could stay in touch with case managers, as well as stay on hold with Social Security and on hold with the doctor's office, and also to get telemedicine. We also had to interrupt services. The whole city shut down, so all sorts of services were unavailable to our clients. So we had to help them connect in other ways. We also, like many of you, I'm sure, have had COVID exposures on staff. And early on, we lost one of our longtime security guards who was not infected at Miriam's, but infected outside our organization. So that was a crushing blow to us. And we also had to cope with tight city budgets. We were very concerned that as the city lost tax revenue, that they were going to have to cut back budgets, which will affect our organization as well as other organizations citywide who rely on public services. Our number one focus, as Dominic said, was to maintain continuity of services. So our first priority was to keep people safe. And by people, I mean staff and volunteers, and of course our clients. And this is Chef Cheryl right here, who came to work every day at 4:30 in the morning. So we had to respond to changing needs of our clients. And as you can see, we served our meals to go. We've never done this before. We've always had a welcoming dining room where people came in, but we had to quickly change entire operations and move everything outside and serve all meals to go. We also had to focus on meals and hygiene, the most important things during a pandemic. Even though we were focused on solving long-term homelessness as our mission, our clients told us they had nowhere to eat, they had nowhere to go to the bathroom, they had nowhere to get water because everything was closed down from, as you all know, the libraries were closed, the museums were closed, McDonald's was closed, all the usual places. So we had to sustain critical services. And I just wanted to say thank you to Qlarant and our other funders who made it possible for us to support our frontline workers. And then here's a couple ways that we did. So as I mentioned, we moved outdoors. We, like everyone else, we had to have personal protective gear that was hard to get. We had to implement safety protocols, and we also had to schedule for safety. We had to get rid of our lot of volunteers because it was unsafe for them to be on the premises. And inside our tiny little kitchen, the chefs were working 14 hours a day. And like all of you, we persevered during the pandemic. We served meals. We helped 130 people find housing. We helped people apply for stimulus checks. We had on-site support from Unity Healthcare, but we also connected people with appointments, managing mental health and medical appointments. We also helped with system glitches. We had some issues with the housing authority closing down. We had some issues with Social Security and the DMV. So together with all sorts of different agencies, we advocated for things to open up. And we used digital signatures on leases, and we helped the Department of Motor Vehicles, encourage them to have services that were online, and especially the housing authority began for the first time to have virtual housing inspections and virtual meetings. And I am really happy to say that we promoted our frontline workers. We kept them top of mind. We had stipends, work from home stipends for people. We had extra salary stipends. We did some modifications of our paid time off and sick policies so people didn't have to draw from their sick account if they or someone in their family was sick. We gave technology to people at home so our staff could work just as effectively from home. We had wellness bonuses that we drew instead of having people use their training, any money that they had for training and personal development, people could use for wellness. We paid for these folks right here, the two people on the left, to stay in hotels for 5 months during the week because they had to isolate from their families and they had to isolate from their friends to keep them safe and our clients safe. And we paid them overtime for their 14-hour days. I'm also proud to say that we paid hazard pay to frontline workers. So I just want to say thank you again. And as all you know, it's all about community and collaboration in order to provide consistent services. And we were very, very lucky that the media was interested in how people experiencing homelessness were dealing with this. So that was part of the keys to success, is we had a lot of media coverage, which drove individual giving and motivated some institutional donors to increase or become first-time donors. So the message for us was be prepared and take advantage of these opportunities, even in the middle of a pandemic. And that's our frontline staff. Thank you very much. We are so grateful. And thanks to you all, we've been able to stay open every weekday since the beginning of the pandemic, providing breakfast and social services, as well as afternoon dinner and social services, and a whole team behind the scenes doing remote work.
Great, Sue. Thanks a lot for sharing.
Thank you.
It was really quite a dedicated group of individuals there. I think Miriam's Kitchen is definitely risen to this challenge, and you all should be really proud of what you do. Thanks. Okay, so actually, I think a little bit early here, but we're going to go ahead and conclude the program for the day on that high note. It's certainly been a pleasure to see some familiar faces along with some new ones this morning. The Qlarant Foundation, again, wants to thank you for the work that you do and the services you provide to some of the most vulnerable people in our communities. These needs were present prior to the pandemic, and they're going to continue to be so after. And we're fortunate that there are organizations such as yours that are there to meet these needs heads on. We really look forward to working with all of you throughout this year. And we do want you to know that you can reach out to us at any point in time if there's anything that you need. So thanks again, everyone. And we hope you have a great day.